The World Health Organization released its 2024 Global Tuberculosis Report. This report paints a stark and concerning picture. Tuberculosis has surpassed COVID-19 as the leading infectious disease killer globally. This is a significant setback. TB is caused by Mycobacterium tuberculosis. It primarily affects the lungs. This airborne disease spreads through the air. The resurgence of TB is a wake-up call. The report highlights a worrying trend. The COVID-19 pandemic disrupted healthcare systems. This led to a decline in TB diagnosis and treatment. Consequently, more people were infected. Many with TB did not get the care they needed. The WHO report serves as a stark reminder. TB remains a major threat. We must act decisively to reverse this trend and save lives. The WHO report reveals a concerning increase in TB cases. In 2023, an estimated 10.6 million people fell ill with TB. This marks a 4.5% rise from the previous year. Low and middle-income countries bear the brunt of this disease. These regions account for over 95% of TB cases and deaths. Social determinants like poverty and overcrowded living conditions increase vulnerability. The increase in TB cases is a global health crisis demanding a coordinated response. Despite the grim statistics, there have been some positive developments. The report acknowledges the progress made in TB diagnosis and treatment coverage. These are crucial factors in controlling the spread of TB. Over the past decade, global efforts have led to significant improvements. More people are being diagnosed with TB than ever before. This early detection is vital for timely treatment and preventing further transmission. Treatment for TB has also become more accessible. The report highlights the increased availability of effective anti-TB drugs. These drugs are essential for curing TB and preventing the development of drug-resistant strains. However, challenges remain. There is still a significant gap between the need for TB services and their provision. Many people who need TB care still face barriers to accessing it. Section 4. The funding gap and its consequences. The fight against TB faces a significant obstacle. Funding for TB control and research has consistently fallen short of global targets. This funding gap has severe consequences for global TB control efforts. The WHO report underscores the urgency of the situation. It states that underfunding is a major barrier to ending the TB epidemic. Without adequate funding, progress towards eliminating TB will remain slow and insufficient. The lack of funding has real-world implications. It leads to shortages of essential TB drugs and diagnostic tests. This shortage directly impacts the lives of people with TB, particularly in resource-limited settings. The funding gap also hampers research and development efforts. This research is crucial for developing new tools to combat TB, such as more effective vaccines and faster diagnostic tests. Section 5. Embracing innovation in the fight against TB. In the face of this evolving threat, embracing new technologies is paramount. The WHO report emphasizes the importance of innovation in TB control efforts. One such innovation is the use of artificial intelligence, or AI, in TB diagnosis. AI-assisted radiography has emerged as a game changer. AI algorithms can analyze chest X-rays for signs of TB, often with greater accuracy than human technicians. Another promising development is the advent of rapid molecular testing. These tests can quickly and accurately diagnose TB, even in remote settings with limited laboratory capacity. These technological advancements offer hope in the fight against TB. By embracing these innovations, we can improve detection rates, ensure timely treatment, and ultimately save lives. Section 6. A call to action, sustaining the fight against TB. The WHO's 2024 Global Tuberculosis Report serves as a stark reminder of the persistent threat posed by TB. The report's findings are a call to action. We must strengthen our resolve and commitment to end TB. Increased and sustained investment is urgently needed. We must prioritize funding for TB prevention, detection, and treatment. Focus should be on equitable access to quality healthcare services. We must address the social and economic determinants of TB. This includes tackling poverty, improving living conditions, and promoting access to nutrition. Addressing these factors will create healthier societies that are more resilient to TB. The fight against TB is a shared responsibility. Governments, healthcare providers, researchers, and civil society must work together. Collaboration is key to ending this epidemic and saving lives.